Good afternoon, everybody. Obviously, you've got my biography, but a good way to think about that is essentially for the past 2 years I've been working to listen to the views of people who don't normally have a voice and try and use those views to make a difference in how health and social care services are created, which fits really well with the subject of today. So the question that I've been asked really before I came here was, do citizens of future cities need to be more engaged in the design, development and shaping of the health and social care systems that they rely on? And the answer to that certainly is yes. Do current structures and approaches to leadership meet this challenge? I would say very often not. And do cities need to be led differently in the future to encourage engagement? Well, obviously I would again say yes. I suppose my response to these questions, having worked with a lot of the most isolated and marginalised people across the southwest, is to an extent, why should they engage? And actually, as I'll explore in this talk, I think you'll start to see why I asked that question in response. Really, to make this kind of progress happen, we need to have an open and an honest conversation about why it currently doesn't really happen as well as it should. Part of the issue is that I think that currently, historically, this debate has been too often framed as poor people ending up being expensive for the NHS, and how can we persuade them to stop selfishly costing us so much money? Sometimes the conversation needs to be allowed to expand into areas of discussion which might actually prove uncomfortable for those asking the questions. The first point that I'd make in this debate really is that money matters. Wherever you go with this conversation, effectively, money will always matter to people, and the linkage is in with that point, obviously, around housing, access to transport, and access to opportunity, and the time to be healthy and to think about your future. I want to start by telling you about a conversation that I had 18 months ago with a man that I'm going to call John, not his real name. This story is typical of many conversations I've had across the southwest, but it's slightly less typical because it happened in Southmead Hospital in the men's toilets. John was taking part, along with me, in an engagement event designed to give a voice to people who normally don't have a voice, which was based at Southmead. And John has some protected characteristics under the Equalities Act. John was black, and John also cares for his elderly mother. And he was very pleased to take part, but he told me quite clearly and forcefully that until he sees a more equal distribution of wealth across society, as far as he's concerned, it's just window dressing. And this was a man who was already taking part in a consultation. Another example is that Healthwatch works across Bristol and the southwest with lots of volunteers and people who participate in this kind of work. Very often we have to be careful to remember to take a pot of money with us, because some of the people can't take part unless they have the bus fare to go home. So these are the kinds of situations that people are really facing on the ground. The Bristol Manifesto for Race Equality, which is a document that I would certainly recommend everybody having a look at, states that BME communities are economically excluded and their potential for economic development is thwarted. So the question, I suppose, is I wonder how many of us would engage with health and social care and invest towards the future if we knew that a mix-up with the provision of petty cash might mean that we don't have bus fare to go home. My second point really is that representative leadership matters. Some of you may have read a document called The Snowy White Peaks by Klein, which was produced in 2014, which noted that 17 of 40 NHS trusts have all white boards, but over 40% of the workforce and patients are BME. Again, if we go back to the Bristol Manifesto for Race Equality, it states that Bristol is a great city, one of the cities that people are happiest to live in, but serious inequalities prevent this being the case for all. We're dealing with inequalities rooted deep into the city's way of doing politics and economics. And so I suppose the question that I would pose as a result of that is, would you believe that your opinions meant anything if the leadership of your city seemed so disconnected from you and didn't, frankly, look like you? The third point that I would make is when it comes to service delivery and experiencing health and social care, negative messages matter. Healthwatch and myself, through that work, we work with some of the most seldom heard and excluded people across communities. And often when we ask people for their feedback and their input into the future of health and social care, their response is, I don't feel that I'm treated equally now. Why should I invest for the future? When we talk to Gypsy Roma traveller people and they say that their GP tells them without any evidence that their children are probably being physically abused at home because of preconceptions about Gypsy Roma traveller people, then it's very hard to overcome that negative experience and persuade people that it's worth investing in developing services for the future. thankfully, it's not all doom and gloom. In spite of these factors, it's encouraging that many citizens and communities do engage and do contribute at the moment, and that seems to indicate a real willingness and good nature amongst many people. It's to their credit that they continue to do so, even when I think many people feel that previous engagement has been tokenistic within the NHS and social care. A good example of this I plucked from some of the work that Healthwatch Bristol is doing currently in this city in partnership with the Clinical Commissioning Group, which is about the Your Healthy Future consultation, a consultation with young people where a group of young people, including I think young carers, have been put really central to the discussion and are really driving some of the work. There are some brilliant examples of this kind of work going on, so it is encouraging that we are seeing some shoots of positive change. Another example from Somerset can be seen in the work going on at Yeovil College at the moment, again, which is something that I'm involved with, where some social care research training is being given to young people who are then committing to go out into their communities and start to do some research into the health and social care issues in their small towns and villages around Somerset. Again, really encouraging. It's clear that when we take the time to listen and invest, people will speak up and they will engage. So to conclude then, supporting citizens to have meaningful influence in the design, development and shaping of health and care systems is difficult. It can be an annoying process, it's tedious, it's time consuming, it can be onerous, and in the short term it's more expensive than not consulting with people and not investing in people. It's an approach that requires a set of skills and approaches that haven't always been valued within leadership circles in Bristol and across the country. Evidence of working on the ground with Healthwatch has convinced me that a great many local people and communities are keen. There is a willingness there for people to shape the systems of the future. It's not so much about whether they're willing to do so. The real question is whether those of us who have power and opportunity are willing to act as agents of change. Are we genuinely willing to invest time, effort and resources in empowering the powerless to bring about change for themselves? Thank you.
Thank you.